if you have neck pain, it's worth looking at the quality of your breath, how your breath moves, as we have this distinct connection between the neck and the diaphragm, right? Your diaphragm is your primary muscle of breathing. It connects to the rib cage, it connects to the low back. It's this 360-degree structure, kind of a dome-like shape that separates the thoracic cavity and the abdominal cavity. It's got a lot of pull on a lot of different areas, 360 degrees through your torso. But why it's connected to your neck is that we have this nerve called the phrenic nerve that is actually telling the diaphragm to move. It's really controlling its movement in a lot of ways. And the phrenic nerve that innervates the diaphragm, it starts at C3, 4, 5, which is cervical spine 3, 4, 5, basically the middle of your neck. This is where the nerve starts. So sometimes when we have restriction in the diaphragm that maybe is squeezing on the phrenic nerve, it can send signals back up to the neck. So this might be an indicator to do some, myofascial release with, working with a practitioner. They can actually get into the area of the diaphragm, free up the ribs and the abdominals that are really connected into the diaphragm. If you do any cupping on your own, you can take a little silicone cup and kind of move it around the rib cage, all along kind of this area for the diaphragm. You can go into the abdominals as well. Another thing that you can do is take a pillow, or you can roll up a blanket for something a little firmer and lay over it. And while I'm kind of lifting myself out to talk, you could lay yourself fully over and finding some compression into the abdominals, and that might get a little bit into the diaphragm too, and deeply breathing into that resistance, that compression. If you have a small squishy exercise ball, that makes a pretty good tool as well to lay on, right? This is a squishy one, it's not a hard ball, but that can be a little more specific massage into the abdomen and can help free up restriction in the diaphragm. You might also just be mobilizing the thoracic spine. I have another video on that, right? Moving front and back, side to side, circles through the rib cage to free this area up. Or just might be intentionally breathing deeply if that's not something that's typical for you, whether that's, placing your hands against the rib cage and trying to expand into the front fingertips, into the sides of the hands, and into the thumbs in the back. You can wrap a TheraBand around the whole rib cage and expand into it. Really anything that works on your breath. Try a few things out and notice afterwards if the quality of your neck pain or stiffness feels any different.